Well, good afternoon, everybody, and welcome to the United Regional Chamber's weekly update. We try and bring you on some interesting guests and some important information. And this week, I'm very happy to introduce to most of you, because I don't think she's been here a ton long, but Miss Allison Brum. She is the City of Attleboro's health nurse. Hello, Miss Allison. How are you?
I am doing very well. Thank you for having me, and it's nice to meet everyone who hasn't seen or worked with me in the community yet. So, my name's Allison. I'm the public health nurse for the city of Attleboro.
And tell us a little bit more about Allison. Where are you from? Where were you before you came to the city, and how long have you been with the city?
Absolutely. So, I'm from southeastern Massachusetts, more specifically the Dartmouth and New Bedford area. And I've done many things. So, I really feel it's never too late for a career change. So, I'm a registered dental hygienist in addition to being a registered nurse. And I transitioned to nursing because I had more of an interest in the entire body and community health. And so I actually was very passionate about public health. So I transitioned from the hospital environment to public health. And that's what brought me here in Attleboro. And I've been here for a year. So it's a wonderful community. I'm happy to be a part of it.
Well, awesome, awesome. Well, I appreciate you coming on today. Today, we're going to ask you some questions, and you're going to help us all understand this new behavioral health helpline that has been established by the state. Um, Tell us a little bit about this helpline.
So, this is a very innovative new helpline that was launched very recently to address the mental health, alarming rates of mental health throughout the nation and across the state. And so, what it is, it's a number that you call to be directed to a live person. And you call if in case you're having any struggle with mental health or substance use disorder, and you will talk with a live person and be connected to local community providers, and it's all entirely free.
And does it cost anything to use the helpline?
Yeah, so this is an absolutely 100% free service, which is very impressive. It's insurance blind, so it doesn't matter if you have private insurance, if you have no insurance, if you live in Massachusetts, this is open access to you. It's free to everyone. And what's so impressive about it being offered to all Massachusetts residents at no cost is all of the incredible services it offers. So when you call this number, you're going to have a real time live clinical triage and assessment with a specialist, and they will offer this in multiple languages, up to 200 languages, and it's available to anyone 24 hours a day, 7 days a week, 365 days a year, and you will receive that live on the phone personal assessment so that they can better transition you to a local community provider.
Well, one of the things that I wanted to bring out a little bit, because we had briefly talked before, because we have such a diverse community, that you can call this helpline and they have just about any language at all to speak. Am I correct?
Absolutely, yes. This helpline is available to you in up to 200 plus languages, so anyone can call. It doesn't matter your background, your income level, where you're from. This is available to you. This is a support system to be there for you when you are experiencing a mental health crisis, if you're struggling with substance use disorder, or anyone you know is. So I encourage all of viewers, when you see this phone number, to save it in your cell phone, because you never know when you'll need it. And you can call, text, or chat.
And when you call, is there a wait time? And do they ever put you on hold?
Yeah, that's a great question. So no one likes calling during a very tough time and a traumatic experience, and having to call and then be put on hold, listen to that elevator music, and have to press buttons to actually talk to a live person. So there is the goal is to not have any wait time, and the goal is to never be put on hold. So the very unique thing about this service is that someone will answer the phone immediately. A live person answers the phone immediately, and their average time to pick up your call is 15 seconds. And then their goal is to not put you on any hold, so that when they connect you to a local community provider, they're going to do a warm handoff so that they're going to actually get a local provider on the phone. and then you're all gonna have that discussion together, and then the person won't have to repeat their story. So if you're having that go through a tough time, and you don't want to have to repeat yourself unnecessarily, so the specialist at this helpline will take your information, and then they will be the one who will transfer that information to the community provider you see, and they'll do that via email and also via verbally. And then there is no exit in this phone call without an agreement of all parties. So you have to agree that you're ready to end the call before it's ended.
Well, that's very important because people need to be heard. They want to talk to a live body.
Yes.
And since you're being assessed when you're on the call, what are the credentials of some of the people that you're speaking to on the other end?
Yeah, so another great question. So, there is always an available licensed mental health specialist when you call this number. So that's a wonderful service it offers. It's a knowledgeable clinical team. So you have masters and bachelors prepared, clinicians. You also have peer specialists. So if you're going through a tough time and you might need that extra support of someone who's been through what you've been through, they also offer that. But you always have the expertise in de-escalation, which is very important during a time of crisis. And as I mentioned before, there's always an available licensed mental health specialist at this number.
And this line is not just for individuals. This line is for family members and family gatherings as well.
Yes, absolutely. So this phone number is for anyone, family members, yourself, loved ones, friends, parents. So, for example, a perfect scenario is if a parent has a child who's struggling and going through a mental health crisis, the parent can call this number, and then they would be transferred connected with a community provider. This is all live person, no holds, no wait time, and you're going to be immediately directed to a local community provider. So if for our residents in Attleboro, that would actually be the Community Counseling of Bristol County, and they're in Taunton. And what they offer is same-day assessment, crisis stabilization, family group therapy, psychiatric consults, psychopharmacology, and medication-assisted treatment, so that if you're a parent, your child will immediately be seen by the specialist in your local area.
Right. And, for instance, if a person doesn't drive or have access to transportation, how can this helpline help them connect to services?
So yeah, that's another great point you make, because for persons who cannot drive, don't have access to transportation, they might be a little bit more isolated in the community. This helpline, the person that you talk with is going to make certain that a mobile crisis intervention unit goes directly to where you are, and that is another free service available to adults, children, and anyone. So they're going to make certain that there's a mobile crisis intervention unit going to you, so that you can immediately get the help and resources you need.
Awesome. And this is so well needed right now, especially since we've all been through all this COVID stuff and people getting stuck out of work. Now, can you explain a little bit about the follow-up process after someone calls and is connected to the services and connected to that individual?
Absolutely. Yep. Absolutely. So as I mentioned, when you call this number, you're talking to a person. They're going to get you a person in your community to really better get you every resource you need. And it's called a warm handoff. And then they really want to make certain that people don't fall through the cracks. So this helpline offers the service, and they ensure that anyone who calls this helpline is going to receive a follow-up call. So if you're experiencing a crisis, or you're the parent or friend or loved one of someone going through a crisis, you would expect a follow-up call probably later that day, or the next morning. So within 48 hours of a crisis handoff, they are going to contact you, and they're going to call you and make certain you are happy, you are satisfied with the care you received. And if not, they're going to make certain that they find that care for you. And then if it's an outpatient referral, you're still going to receive a call within 14 days. So there's always a follow-up. We don't want anyone falling through the cracks, when they access this service.
Well, you and I are both part of this community intervention program that was started on this mental health. Now, how does this help the emergency departments, the police departments, and the EMTs?
Yeah, so the interesting thing about this is that most people think that 911 or the ER is their only option. So the ER is a very stressful and chaotic environment. During a tough time, ERs are overcrowded and understaffed. So individuals and their families might not feel comfortable going there. So if 911 or EMS is needed, the specialists at this helpline will get them involved, but their goal is to make certain that you get live, local, in-person care just as quickly, just as efficiently, and without the added stress. And this is probably, the first time your viewers are hearing of this helpline. I know I discussed it, and I shared it with you because you've been very involved with, mental health initiatives in the city. And so this was launched recently. It's a new innovative strategy to address alarming mental health rates, and we're very, very excited that it is available.
Well, it's just one of the many great services that are offered through the city, and this one's through the state.
Yes.
But
Yep.
you have a pretty busy workload. Tell us some of the other things, and we'll come back to the mental health line in a minute, but tell us some of the other things that you do as the city health nurse.
Absolutely. So I want to say I'm really passionate about prevention. I really feel that, the healthcare model needs to focus more on prevention and getting resources so that it's not just about treating, the illness or the disease. We should really, encompass a holistic view and really try to prevent this. And I do feel it involves community support. So as a public health nurse, I love being involved in the community. I will do wellness checks. I'll be involved, with local persons in the community who might need a little bit extra support. In addition to that, there's a lot of things that we do behind the scenes, such as preventing an infectious disease outbreak. There's many reportable infectious diseases in Massachusetts, and we want to make certain that we're always following up on them and really making certain that your community is safe, and above all, making it a healthy and, a happy place to live.
Well, I've lived in town a long time, and I really enjoy the city and all the services that are offered here. I know that you've done some COVID inoculations. I think you've got some scheduled to come at City Hall here shortly.
Yes.
But thank you very much for taking the time to coming on today and talking to folks. Hopefully we can get the word out a little bit more about this behavioral health helpline, because it is something that is desperately needed all around. Every one of us, every family has dealt with this in the past.
Yes.
I'm sure we'll deal some with it in the future. But it's good to know there's a resource that they can call. Miss Allison, thank you very much for coming on the show today. Any last thoughts?
Just thank you so much for having me, and I'm really glad we can spread the word on this. So thank you.
Okay, folks, thanks for joining us again this week. Thank you, Miss Allison, for coming on. And big shout out to the guys over there at AACS, James and his team, for putting up with me. And we had a couple of little glitches today that he got worked out. So, folks, thank you. Everybody, please stay safe.
Thank you.